there's a lot of opposition from the Dental Association on it. The dentists are, I think they're afraid that the funding that they receive will be lessened in some way, but from other countries that have worked on this bill or that have a similar program, have actually seen that it's expanded care and increased their patient, intake, right? So in the long run, it actually expands care, but the way it currently is right now is receiving quite a bit of opposition. So I think it's a little bit of the dentist opposition in addition to political pressure. So all those things play together.
Thank you. Well, maybe next year, right?
There's always a chance.
And next, I'm going to kick it over to Karen in a second. But before I do that, does anybody have any questions for Nicole that they would like to ask right now? You can also email her. I see that she put her email in the chat. Thank you so much for all of, all of the work that you've been doing in our local legislature this year, Nikki.
Sure, no problem. And one quick thing, if you are interested in following the Universal Healthcare Commission, that meeting is today at 2 p.m. and I was recently appointed commissioner to that. So I think today we're going to be looking at healthcare coverages in Washington since COVID-19 started. We're also going to adopt our charter and review some of the stuff that's been going on in the Health Cost Transparency Board.
Oh my gosh, you don't have quite enough going on right now. So good.
Just a few things.
If you could volunteer for some more things, that would be really great. Well, does anybody have any questions that they want to ask right now before I kick it over to Karen? Going once, going twice. Karen, it's all you.
Well, thank you so much for inviting me again. This is the second time I've been able to be on this particular committee to just talk about kind of some of the issues that we are working on. My name is Karen Ferguson. I'm the founder of Our Stories RX, and we're really a collaborative storytelling platform that brings together the stakeholders, meaning the patients, the physicians, pharmacists, and also employer groups who pay to the extent of our bills for premiums. That brings together the stakeholders to from across our healthcare system to really advocate for policy changes that will protect the medical decisions that are between the patients and the doctors. And I founded Our Stories RX after a 20-year career at Arthritis Northwest as the administrator. And what I was able to see with really the boots on the ground of the physicians taking direct care of our patients was that to a large degree, our physician practices are really handcuffed in today's sense of the word to be able to provide the right treatments for the right patients at the right time. And what we actually were seeing is that with the integrated PBM network, the pharmacy benefit managers now being integrated with the insurers group, they really do have the control of the formulary control, the cost of our meds, and doctors are really left to have to utilize different pre-authorization tactics that are really coming between the patient and the doctors. And I'll give you an example of kind of what we're about. And so our concept is to bring our voices together so that we can speak from the patient perspective, from the physician perspective, from the pharmacist perspective, and our employers to the harm that's really happened in between the patients and the doctors to be able to provide quality care and better patient outcomes. And I think that a really good example is some of the stories that we've been able to collect. And one of them happens to be, if you could turn the slide over to the next slide, is Beth Waldrop. This is a patient that had shared her story on Our Stories RX, and it just really resonates with what is happening out there. So Beth was actually has been on an anticoagulant for over 18 years, and she had a hospital. She had clotting issues that caused her to go into failure with and was put in the hospital after the same thing happened with her dad, which he died of. And so she has been managed really well on Eliquis, which was a very safe and effective through the research channels, specialty med that has been helping her for over 18 years. And this year was the first time that she received a letter from CVS Caremark that made her switch medications, even though she was doing really well on this medication, has had no events at all with her clotting issues. And so this is called non-medical switching on stable patients. And it's just egregious behavior from the PBMs who might have gotten a better rebate or did a better negotiation with another drug, and is actually making the patient switch. And the reasoning for the patient switching, the letter basically said that she had to switch due to safety and efficacy of the drug. And this is really where it really rubs wrong, is that this drug has tremendous efficacy, research efficacy papers behind it, and has been, the doctor has been in agreement that it has been working really well on this patient. But the worst part of this is that you can go through an appeals process. In Washington State, we actually have one of the best appeals processes due to our legislator who put in a protection for appealing expedited denials. And so even if she went through that and went through the length of having to battle the appeals process, which is quite onerous to physician groups, and we do it all the time on behalf of the patients. But even if she won that appeal, the second part of that is that if she won the appeal to stay on Eliquis, that the PBM actually increased the cost for her to stay on it. And it would have cost her $2,400 a year to stay on the medication that she has been on for the last 18 years. So this is the kind of egregious things that we would like to really start working on behalf of our patients, but also our physician groups, our pharmacies, and our employer groups. And so the reason why I'm really telling you this is we just launched a new section of our website in hopes that we could populate with all of our different associations and logos. So for example, she works the advanced cardiology group, and we're happy to supply our efforts in letters with Our Stories RX as the logo, but we'd love to have anyone's organizations to help us populate the logos on our partner organizations that have these same shares and concerns. And really our important message is to use our voices, real voices, not just data-based, to our legislators, because they obviously have a much more compelling story when you see what's happening to Beth and having to change a medication, or it's going to cost her $2,400 to stay on her same medication. So we would really, if you're interested, we'd really love to have your support and have your logos put on ourstoriesrx.com. And you can go on there right now, submit stories of anyone that you know, or we could link it out to through your organization, just as a way for anyone to submit stories so that we could start gathering this for legislative purposes. That's our real goal, is to bring these compelling stories to the legislators.
Thank you, Karen. Compelling as always. I feel like you are always able to take a really complex issue like PBMs and make it really, really interesting. So thank you for that. in the vein of sharing things on social media, the other thing, if you guys want to do this, no pressure, but what I will be doing is I always like to take a picture of what my desk setup looks like when I'm in a presentation, because there's always cats crowded around the computer watching the presentation as we do it. And then I will tag We Work for Health on there to show that we're giving our federal update. So feel free to post a picture of what your home office setup looks like, since we are still in this world. Happy 2022. And now is the time where if anybody would like to ask any questions to anybody who presented today or anyone who is here, as well as give some updates on your organization, anything is on the table. If you just want to tell us a story about your day, that's great too. Now is the time.
Hi guys, I'm Rod Shutt with the Prescription Drug Assistance Network, and some of these kinds of issues around medication access might be something that I can help out with. So if you have someone who is having trouble accessing a medication they can't afford, reach out to me. Our website is prescriptiondrugassistance.org, and you can, it's got my contact information, as well as my colleague in Spokane's contact information. You know, it's very situation dependent as to what I can do. You know, I don't have like a pool of money that I get to distribute, or an inventory of medication I get to distribute. But I've been doing this for about 12 years now, and I'm familiar with the way these different programs and all work. So yeah, feel free to connect me with people that you are working with that are having trouble. I might be able to help, I might not, but it's certainly worth giving it a shot. Thanks.
Thanks for that, Rod. And Rod put his contact information in the chat. So if you guys go to the chat, you can see his email there.
Rod, that would be extremely helpful. As you know, most of our patient assistance programs get dried up because they're, you know, we have to make sure that the patient submits application at the first part of the month for those, because there is a lot of crowded efforts with Medicare Advantage, even plans that are kind of coming in and pushing that. So if there's another patient assistance programs that we could even offer to provider groups to help contact for our patient assistance, that would be absolutely fantastic. I know that employers would absolutely love that as well.
Yeah, so you know, like I said, what our organization does, what we do is we connect individuals to other programs that are out there. Manufacturer assistance programs, private copay assistance grants,
nice.
You know, all that kind of stuff. And, you know, like I said, there are different eligibility requirements and procedures and all that other kind of stuff, but we help people work through all that.
That is just fantastic. You know, one of the things I think that might be really interesting to talk to you about it a little bit further in detail, and if you leave your phone number, we can have a call. But one of the things that we really feel is that, you know, the minute the doctors order some of these specialty medications is the time that we should really include the patient into that fold right away, so that we can actually work with that patient immediately to get them to really understand that it's going to take a level of their support as much as it is the physician. But to the most part, the patient has more of that power than a physician group does. So
right, and it's you know, a lot of times that individuals are challenged in that they don't realize that they have to advocate for themselves, and will often not pick up that ball and run with it. And one of the things that I try to do is educate people on the necessity of being an advocate for yourself. So
No, fantastic. I'm excited to be able to
Yeah,
talk
reach
to
out
you
to
more
me.
about that. Okay.
Thank you, Rod. And does anybody else have any other questions that they'd like to ask while we're all here? We have 3 minutes to spare, which we did really good. So
Well, I want to echo what Bailey and others have said. This has been a really great conversation, and I think we surfaced some good dialogue and raised some good questions, and maybe even found some good answers. So really appreciate you spending part of your Friday with us, and we'll follow up on the Medicare Advantage issue that was raised earlier and circulate that. And again, let us know if you have questions or concerns or need information or connection. We're happy to be a resource for you going forward. And I hope y'all find these things useful. I find them useful in hearing what you're up to and hearing your questions. So we'll try to keep them going. And if, knock on wood, if things go well with the coronavirus, we'll be able to do this in person, maybe in Q2 or Q3, maybe Q3 if we're in Seattle and we can do it outside safely. But again, really appreciate the dialogue and the time that you shared with us today.
Thank you.
thanks.
thank you, everyone. Have a good rest of your day. Enjoy the
Thanks.
weekend.
Thanks.
Okay,
Thank you as
thanks.
well.
Thanks, everyone. Bye.